a little bit of an overview of the pharmacy profession. So welcome, you guys. So if you guys want to kind of introduce yourself and give us a little bit about your background, and then we'll hop right to it.
Thank you, Meredith. We are very excited to be here with y'all. I hate we can't be in person, but we'll take what we can get right now. As Meredith said, my name is Kristen Pate. I am originally from Natchez, Mississippi. So I was born and raised kind of somewhat an Ole Miss fan through various family members, but I also have some Louisiana roots as well. So I have a lot of Louisiana background and LSU fan. So I was kind of pulled, but I'm an Ole Miss fan at heart. And so I grew up wanting to go to Ole Miss. And then when I decided to do pharmacy school, it just made all the more sense. And so grew up in Natchez, went to Ole Miss for undergrad and then pharmacy school. And here I am.
Yeah. And you also did the early entry route too, right?
I did do early entry. I did the early entry program. That was a great opportunity to be able to go ahead and get involved in the pharmacy school early, because I knew pretty early in my career, way earlier than I probably should have, that I wanted to be a pharmacist. I'd looked into the early entry program as probably a sophomore or junior in high school. And so I applied, I got in, and it really, it added a lot of value to my overall pharmacy experience. But, you know, there's people like him that didn't, and he had a great one too.
Yeah, so good intro for me. I grew up in Natchez as well. We were not high school sweethearts, but we did both grow up in Natchez. My path was a little bit different in terms of getting to pharmacy school. So after graduating high school, I graduated from ACCS, for anybody who's familiar with the Natchez area. And after graduating from ACCS, I went and did junior college for 2 years. The common question I get there was, did I play baseball or did I play any sports? And no, I did not. That was just the path my family always took. Like, you graduated high school, you went to junior college, and then if you cut it in junior college, you went to the big leagues and went to a big school. So after I finished junior college, I went, and at that time it was only 2 years of prereqs. And so after junior college, I went straight into pharmacy school here at Ole Miss.
All right, I have to ask, what was y'all's favorite memory and favorite place to hang out in Oxford?
That is so tough. I mean, I kind of, you know, being in the early entry program, I was involved with pharmacy kind of from the beginning. So I had my early entry friends, but then I also did the traditional social Greek route as well. And so I was a FIMU, and I had my FIMU friends as well. So it's kind of hard, and you're kind of calling us out because that's been a few years ago. My memories at this point are more general, like game days, of course, pharmacy functions, just studying with friends, especially maybe even more so in Jackson, honestly. I think some of my favorite memories are our late night studying with our friend group that just, you know, we stayed up way too late and had too much fun, but we obviously did enough studying as well.
Yeah, and I think the great thing about Oxford is the simple answer is the favorite place to hang out was the square. I think that it was an easy button in the day. It was like you didn't have to figure out where you were going to go, but everybody's like, we're just going to go to the square and figure it out from there. And so lots of good memories for sure.
Oh yeah, square's a fan favorite. So can y'all kind of talk more about what influenced you the most wanting to be a pharmacist? Kind of, you know, who influenced you? What kind of drove you that pharmacy school route instead of the traditional? You know, people think healthcare. Why didn't you go to medical school or nursing school or dental school? So why pharmacy?
My mom is a pharmacist, so I grew up. So I remember still me and my brother crawling around on the floor of the hospital pharmacy, picking up drugs that had fallen off of the shelf. And that was mostly just to keep us busy. It wasn't always doing good things like that. We also filled up a lot of the gloves with water and poked holes in them and stuff, just to stay out of my mom's hair while she was finishing up work and we would be out of school or something like that. So I've always been around the pharmacy profession. And then when I got into high school, I started working for a local independent pharmacy and really loved that. And so I guess I could thank Bill Skinner in a lot of ways for some of the influence there. And so it was always just kind of something that I wanted to do. I considered other things. I think maybe some other people have the same issue. For me, going to a small high school, it seemed like if you were capable and you were doing well, everybody says you're going to be a doctor or a lawyer. I don't know why pharmacist was never on that list. But really, I think what sealed the deal for me was I shadowed, because I thought really hard about medical school, and I shadowed a physician, and that was not what I wanted to do. After one day, I thought, this is not for me.
And for me, I did have a couple of family members that were pharmacists, so I at least had an awareness of what the pharmacy profession might look like. But more so just the strictly, this is a community pharmacist, this is a hospital pharmacist. So at that time, I had no true idea of all the opportunities a pharmacist has. But then at a very early age, I was probably only 9 or 10, a family friend took me to campus for a football game, and he somehow convinced a security guard to let me into Thad Cochran. And at that time, so for those of you who don't know what Thad Cochran is, that's our main pharmacy building. And at that time, it was very new, again, showing my age. It was very recently opened, and he convinced somebody to let me in. And so that security guard, who probably shouldn't have been doing this, took us on a pretty extensive tour. Even in some of the labs, I got to look in microscopes and things that, to me, as a 9 or 10-year-old, were really cool. Even though now I don't do much microscope looking, but it was enough to really kind of solidify my interest. And I, obviously at the age of 10, I didn't know what a pharmacist did, but I kept that in the back of my mind. And even though I kind of considered, should I be a dentist or should I be an eye doctor? Those were some of the other things that I thought about. But ultimately, I think it was, knowing that Ole Miss had such a great pharmacy school, knowing about the early entry program, having the opportunity to both work with patients, work in healthcare, and do those things that I was interested in, but maybe not to a different degree of a nurse or a doctor, kind of specialize in the medicines. Obviously, I was very, I will say, good at, maybe interested. I enjoyed chemistry in high school, more so than biology probably. And so that's another thing that leaned me a little more in the direction of pharmacy.
Okay, so can you guys tell us a little bit more about like what you guys do now? So what areas do you practice in, and what is your role within the School of Pharmacy?
So right now we are both what you call ambulatory care pharmacist as far as our clinical role as a pharmacist. So this is one aspect of clinical pharmacy, and anytime you're talking about clinical pharmacy, that's more patient-centered care where the pharmacist has direct one-on-one interaction with the patient. Obviously that can and is often the case in any role as a pharmacist. You're talking to the patients, you're talking to the doctors to make sure the patients are getting the right medication. But in ambulatory care, you're involved in a clinic setting. It could be multiple different types of clinics. My clinic right now is an internal medicine clinic here in Oxford. And I work with the doctors, with the nurse practitioners, with the nurses to help in whatever way I can ensure that the patients are getting the best medication for whatever conditions they have. So it may be talking to the patients about the medicines they're on to help confirm what they're taking, how they're taking it, make sure they're not having any problems with it. And then if there are any potential problems with their medicine, like they're having side effects or they're having trouble getting it from the pharmacy or their insurance doesn't cover it or it's too expensive, then I can intervene even further to help make sure they're getting the medicines that they need, they're able to get them, they know how to take them properly. I do lots of patient education, especially with more complicated medicines like insulins and inhalers. So it's lots of education, lots of working with the team of healthcare providers to just hopefully ensure that as the medication expert, I can do what I can to get the best healthcare outcomes for these patients.
Yeah, and really the same for me in the ambulatory care space. So before, in my previous life as a pharmacist, I did internal medicine. So I was on the inpatient side of things. And that's a really fast-paced environment. It's a great role for a pharmacist to have as well, because obviously there's a lot of patients who come in and they're taking different medications at home, and it's restarting those medicines. It's preparing for them to get discharged. It's making sure the medicines we put them on in the hospital. So I did that. But then now I am also in the ambulatory care space. And I do a lot of the same things that Kristen does. I think some of the different things that I do that are kind of buzzwords are I do chronic care management. So any patients who have 2 or more disease states and have are more complicated patients, this is a free service for them, and I come alongside there and I help manage sort of the whole patient. So what that looks like is we look at all the medicines very intensely, being a pharmacist, and all the providers are very thankful for that. But then also I do all sorts of other things. Like I work with social work in order to, because some of the patients I talk to, food insecurity may be an issue. And so it's getting them aligned with things like Meals on Wheels. I've investigated something called the Silver Sneaker Program for people who wanted to start working out. So I do a whole lot of stuff with that. And then recently I've been doing helping do some Medicare annual wellness visits, which are just annual checkups for those that are 65 and older and have Medicare. And in that, we take blood pressures, we do depression screening, we also do dementia screening. And during all that, we're sort of just preparing the patient for, and just doing a check-in annually that then the physician follows up on and works from there with.
That we were both on faculty in the School of Pharmacy here in Oxford. And with that, because we're on faculty, our clinical services are 2 days a week. That varies for different faculty members, but for both of us, that means we're at clinic on Mondays and Wednesdays, and we take rotation students there with us, sometimes pharmacy residents, but mainly P4 students, and then some early rotations as well occasionally. So they can help get a feel for those clinical roles that we do outside of the classroom. But the other days of the week, we are also helping with the traditional courses, the didactic courses in the pharmacy curriculum. I primarily am involved in the teaching team leader for the P1 Pharmacist Patient Care Process course series.
Yeah, and same here. I help coordinate the P2 dermatology module and then teach whatever they tell me to, but also just kind of any area that I have any sort of expertise in. I teach a few courses in the classes in the P1 year as well.
Awesome. So before we I'm going to have you guys in a few minutes kind of give an overview of the pharmacy profession. But one thing in light of the coronavirus and all that's going on with COVID-19, how has it changed for your work life and your family life and all of those things, and for what you do specifically?
Well, as far as clinic goes, clinic changed dramatically after all this started, and staffing went down. They were having only the most essential providers come. And so at that point, it was kind of decided that I would take a more remote role and try to do what I could remotely from clinic. And so I could access the health records from my computer. The nurse practitioner would generally just text or call me if they had a question that I could help with. But, before we knew what was going on with this and the best safety procedures, they were doing telemedicine visits only. They weren't bringing clinic patients into the clinic. And so we did everything we could to hopefully keep the patients safe and keep all of the healthcare workers as safe as possible. Now we are transitioning, back to normal. We have set off a certain portion of the clinic that is the viral clinic. So any patients that we suspect may have the coronavirus go to a separate area, and there's one healthcare provider each day that's designated for the viral clinic, and the rest of us kind of stay in the healthy patient area and do more of the chronic disease management. So we, patients with diabetes, hypertension, high cholesterol, heart failure, that kind of thing. From a home perspective, we have 3 kids, and so we didn't mention that, but we have Aubrey, who is 8, Eli, who is 6, and Ivy, who is 4. And so we have gotten to brush up on many of our elementary education skills. I am very thankful for their teachers. I've always been very thankful, but this has given me a new level of appreciation. It's also given me a new level of appreciation for people who do work from home, because that is harder than it sounds. Because when you were trying to somewhat homeschool your children, do your own job, and make sure everybody stays safe and sane, it can be quite challenging at times, but I think we've made the most of it. Our kids, I think, have adapted quite well. And if you had asked me this a few weeks ago, I might have started crying. I don't know. You know, I'm just joking. It hasn't been that bad. But it's definitely juggling. You know, it's realizing that work isn't necessarily from 8 to 5 on Monday and Friday. We've probably done more working early morning, late at night, done, you know, stuff on the weekends to be able to balance and not, you know, we can't obviously just lock our kids in a room from 8 to 5.
Yeah, I think it's kind of, I think as for everybody, I think it's just turned everything upside down. So my module went completely online. So in a matter of days, I went from having a really good plan that was going to be in class, and then having to switch that and still make it something that students would learn from, and then also get the material they needed to progress in the curriculum and also be ready to take the NAPLEX. All of those things so that was a lot. It took a lot. It was a big team effort in terms of everybody involved. So I was really, really thankful for the faculty that we have here at Ole Miss, because we've got some of the best group of folks to work with who really care. I mean, we had a lot of faculty members that shared all of their cell phone numbers with the students, because we knew everybody needed somebody during this time. And then also getting used to the Zoom thing. And so everything has shifted to Zoom. And so there's been a lot of meetings and a lot of things that have changed in that sense too. So just getting used to the new normal has certainly been fun.
oh yeah, it's been a blast for everybody. So
yeah.
I kind of transitioned into these last few minutes together. How would you give, if someone asked you, you know, tell me about the pharmacy profession, if you had, you know, if you're talking to a high schooler or maybe a college freshman, and they, you know, just ask, you know, tell me about the pharmacy profession, what would you tell them? You know, a lot of times we call pharmacists the medication experts, but I don't think it can just be encompassed in that. So how would you guys explain the pharmacy profession, maybe your favorite parts of the pharmacy profession, and the challenges you face as well?
I think probably one thing about the pharmacy profession that's really great is there is a strong sense of community within the profession itself. So regardless of what sector you work in, because there is a large variety, so that's one perk I would say for somebody who's considering it, is that you could work in any number of different fields. It's in the hundreds. I don't know the exact numbers of how many jobs there are, but there's a lot of opportunities that you can do. But even within that, a pharmacist is a pharmacist. It's a very small world, and it's kind of a neat little community to be a part of. So I think that's a strong selling element to me for something to be in. Also, a lot of the things in pharmacy, it's an evolving profession. I think that's exciting. So there's a lot of really exciting things going on right now in the world of pharmacy. And I think it's a great time to be in the profession to help change it and transition it as it moves going forward.
And to kind of expand a little bit on what Adam was saying about the versatility and the numerous career options within pharmacy, because that was one thing I was going to mention as well. I always tell, you know, people who are thinking about going to pharmacy school, and for me, once I really started learning about all the different career paths, that was a huge selling point to me, because now as people who have been out of school for 10, 11 years, I guess, we have numerous friends who are pharmacists who have changed career paths multiple times, even though we haven't really. But the great thing about pharmacy school is we prepare these students to be pharmacists. They get their doctor of pharmacy, they learn what we call the pharmacist patient care process, and then they can go apply that in any setting. Obviously, it's going to look a little different, and that's the great part about the versatility, because you can go work in a hospital, and if you don't like that, you could maybe go work in a nursing home, or you could do nuclear pharmacy, or you could work in a community pharmacy, and all of those things, your role is very different, your work setting is very different, but at the same time, you're still a pharmacist and using these same skills and foundation that you learned in pharmacy school.
And at the end of the day, you get to help people. I think that's, no matter where you're at, you're helping people. You're helping other healthcare providers, you're helping patients. And I think a lot of times, like yesterday, I made my chronic care management calls, and as an example of a COVID-19 change, a lot of the patients I talked to have been in quarantine. They're over the age of 65. And literally, I've had 45-minute to hour-long conversations with these people that had nothing to do with their medicines, but I sort of had that. So I think that's the thing about pharmacy, is you're just helping folks. And if you look at the community of pharmacy and you talk to pharmacists, that's a central element you'll usually see, is they like to get their hands dirty. They like to get in there and then just help.
Awesome. So what challenges are pharmacists facing today? What are the most challenging aspects of your job?
That's tough. In my particular work setting right now, I would say one of the biggest challenges is making sure patients have access to their medications, because with the healthcare system, with insurance, with especially older patients that have a limited and fixed income, sometimes when they're trying to meet their deductible, or if they get in the gap as Medicare Part D patients, it seriously becomes a situation where they may not be able to get them. And so it, especially for us, because as pharmacists, we care and we want the best for our patients. And so it's trying to figure out, sometimes it's almost like a game, and I feel like I've won if I can figure out a way to make sure these patients have access to their medications, because, for multiple different reasons, between formularies and pharmacy benefit managers, it's just not as easy as your doctor writes you a prescription and you can go to the pharmacy and get it. There's lots that has to happen behind the scenes and between those 2 points.
Yeah, and I would echo that. I think some of the other challenges for me, in particular, one I would say is patient compliance. I think most pharmacists, so sometimes it's tough when you have people who just, who for one reason or another aren't taking their medicine correctly. And the challenge for me is time. Quite honestly, I think the need in both of our clinics is a lot greater than just 2 days a week, but given our faculty roles, that's what we have. And so it's really exciting to me to see students who come through and are on rotation with me and say, how can I do what you do in an outpatient clinic? And there's a lot of ways that it can be done. And I think that's what's exciting, is to see young students get excited about it and then want to start trying to model it, because definitely time is a challenge.
This is how I plan to end all of these summer speaker series. What piece of advice would you give a student that's interested in going into not only pharmacy, but the healthcare field in general?
I think the thing that I would tell them, if they truly want to do this, is from the very beginning, keep the end in mind, keep the patients in mind, and keep wanting to be the best pharmacist in mind, because in school, it's so easy for us to see these students who are focused on just making the grade to make the grade. And obviously you have to make the grades to stay in pharmacy school and to get in pharmacy school, but the bigger picture is more important. And I think if they keep their eye on the goal of wanting to be able to provide the best care for patients, then that will help students know, like, I don't just need to memorize this, I need to actually understand this, because I'm going to need this later. I'm going to need it in a different class. I'm going to need it when I'm actually caring for patients. And then that will help them not only make the grades, but also truly get the information and understand it and be able to be the best pharmacist they can be in the future.
Yeah, I would echo that. I would also say, make sure that you're prepared for whatever opportunities you want. If it's pharmacy school, if that's there, I think Absolutely. Make sure at the end of the day that the decision is yours. So if you choose to go into pharmacy school, get all the prerequisites done, make the grades, make that happen. If you choose to go another path, make sure it's your choice. And I would say when you're talking about a career, that's a big commitment. And at that age, it's a terrifying commitment. So don't feel like you're 100% booked on whatever you have to do from the beginning, but try it out. I would say go talk to a community, go in the drugstore and ask to shadow somebody. Go shadow somebody, get a feel for this profession, and shadow multiple people and just look at what it is. And I feel like if you do that, I hope you fall in love with it like we did. But definitely go look at the jobs you're thinking about. And get a feel for a day.
Awesome. Well, thank you guys both so much for joining us. To everyone out there, thank you so much for watching. Don't forget to hit like, subscribe, and in the comments below, tell us what you like and what you want to see next. I hope you all have a great summer. Bye.